Health information is everywhere. It's confusing. We're sitting down with doctors to help make sense of it.
Take me to Krause.
Take me to Krause.
Take me to Krause. They saved my life.
Welcome to the podcast studio at Krause Hospital. Our guest today is a very familiar face. Dan Cummings anchored the news at News Channel 9 for nearly 4 decades, morning, noon, evening, late night. It seemed like he was always on. And this is one of my favorite photos of Dan and I when we were doing the 5 o'clock news, taken, of course, at the State Fair, circa 1995, 1996. Dan, welcome to Take Me to Krause.
Thank you. I had more hair then, but I was blessed to have that opportunity, not only to work with you, but to do that TV thing for all those years. Mm-hmm. It's good to be here.
Everybody knows you. What everybody doesn't know is that at the middle of the pandemic in 2021, you decided it was time to retire. And I looked at that news as something wonderful for you because you would have time to pursue your many passions, including running. You had been in so many great races, the Boilermaker, you were always going out for a run, you and your daughter ran together.
New York Marathon and 4 other marathons.
There you go,
Yeah.
See? All
Just
right.
wanted to drop that in there.
Well, it was a real problem not too long after you stopped working. You didn't feel well.
At all. I got on the treadmill in the middle of January, just a few weeks after I retired, thinking, no excuse now, time to get back in shape. Because the pandemic, we'd all gotten a little
Right.
Go running some more. But after just 20 minutes, Carrie, on the treadmill, right in the middle of January, it's like, that's all I want. I'm done. I stepped off. Just discomfort. It wasn't any heart attack symptoms, to my knowledge. It was just, I feel tired. The upper part of my body feels uneasy and just worn out. And after 20 minutes at a very slow pace.
Right.
And that kept going on. And so I had a physical coming up with my doctor, Mark Erlbacher, who's awesome. He helped get me to Krause to get fixed up. But before I even knew I had to be fixed up, I had a regular physical with him, and my annual physical in March. And I went and I waited till then. I went in and I said, Mark, you know what, I'm okay, but I don't feel so well. I've not been working out like I should because I get tired on the treadmill.
So you had continued to not feel well.
Oh, yeah, for weeks.
Okay.
For weeks. But it felt like me just being tired. And I got the physical, and I told him what was going on. And he said, well, you do have a history on your mother's side, because he has my whole health history.
Right.
And I don't like what I'm hearing, but so let's get you in for a stress test. And thankfully, he did that 2 weeks later on St. Patrick's Day of 2022. I went in for a stress test with Krause Cardiology, and I failed it.
What does that mean, you failed it?
Well, they put me on the treadmill, and they kept pushing up, and at one point they kept pushing the pace like they do on a stress test, and they already got the echocardiogram
Right.
going, and all that they said to me was, just let us know when you begin to feel anything, if you do. And after they began to push it up at a higher elevation and a faster
Right.
speed, there came a point where I said, okay, I feel that now. And they said, okay, we're going to slow it down. We want you to get off, lay back down, and we'll take a
Right.
look, and we'll bring the doc in. And the doc came in, Dr. Bohini, and he said to me, Dan, okay, when we saw you on that stress test, he said, when you're working out like that, your heart is supposed to be getting smaller. It contracts. It's working hard to keep your blood
Right.
pumping. Heart is supposed to contract and expand, but contract and get smaller when you're working out.
Right.
He said, your heart is getting bigger when you're working out. He said,
What does that mean?
well, he said, about the only thing that normally means is there's not enough blood flow getting to the heart, and it has to just work so hard to keep things going. So he said, and it's probably a blockage somewhere. He said, we don't know. I can't see that on the stress test. I can't see that on the echo, but we can see it with, we'll get you into the cath lab at downtown or up the hill here on Irving Ave
When?
the next day.
Yeah.
So I came into the
Right.
Krause cath lab
Right.
the
And
very
your
next morning.
expectation was that you might get a stent to open up the artery that was blocked. Is that
my hope?
Yeah.
If they found a blockage,
Right.
they'd find out where the blockage was, if there was one.
Right.
And then they would, balloon and stent it up. Or if they couldn't, I knew I would be a candidate for open heart surgery. Dr. Eula Hannon made that clear. he said, before I went in, he said, there's a number of ways this could go.
Yeah.
He said, best case scenario is we locate the blockage right away and we balloon it and we stent it and we'll send you on your way within a day or so.
So you're laying there, and you're awake, right?
Wide awake, very conscious and alert,
Right.
sedated though, so I was
Right.
cool.
But you were cooler than you would be if you hadn't had some medicine. But you were hearing things that I'm guessing were not reassuring.
Only because it took so long. And yes, I could hear Dr. Ulihanen talking to his team that was assisting him for this little procedure. And it was clear because he kept saying stent in, stent out. Stent in, they had the catheter coming up through my wrist here, and
Yeah.
stent in. I remember those phrases exactly. I knew that wasn't good because
the stent was supposed to go in
and stay in,
yeah,
and fix it.
Right.
And so after, I don't know, an hour of that or more, he said to me, listen, Dan, I'm going to consult with one of my colleagues here at Krause, but I'm going to try something and he said, we just got this machine in here maybe a couple months ago, and I've used it once or twice. It's called the Shockwave machine. Sonic pressure waves to break up hard calcified plaque in coronary arteries, allowing for stent placement. And that finally worked. He brought it in. He said, you're going to feel this now a little bit. He said, because you haven't felt anything yet, and I haven't,
Right.
because you don't. With the catheterization, he said, you're going to send in some of these shock waves, and you're going to feel it a little bit every time you hear that beep, you're going to feel it. And I did. And then after he did that, I want to say 3 or 4 times, then he was able finally to place the stents. And instead of saying stent in, stent out, I clearly heard him saying, nice. And his nurse that was attending said, nice. And I can never tell that story without getting this way at that point, because I had a feeling at that point that nice meant exactly that they were finally able to place not one, but like 2 overlapping stents. You're going to talk to him. Maybe he can tell you what they did. But
Yes.
the thing is, they did
Okay.
it. And they were able to open up that artery. And he came in and told me in the afternoon, when my wife was able to join me, that there was a 95% blockage in the LAD. I think it's the LAD. They call it the Widowmaker, that artery.
That is so incredibly chilling. I mean, I'm glad you didn't know that while you were laying there, and you could just, wait for this really miracle for you
Yeah.
to happen. So, I mean, I hate to even wonder what would have happened had you not gone to see your doctor and had you not been sent for the stress test. I mean,
Well, I've wondered it too. I asked the doctor the same question you just asked me, and Dr. Ulihanen said, well, he said, we'd be having perhaps a very different conversation now. And then he said, at least I'd be having that conversation with you, Mrs. Cummings. Because
yeah.
a heart attack, I was probably waiting for a heart attack to happen. And you never know where you're going to be when that happens.
Right.
But if I had kept working out or trying to get back, I don't think you go long with a 95% blockage if it doesn't get fixed and not be a prime candidate for a heart attack. God knows what would have happened.
So looking back on it now, because we now have the benefit of hindsight, were there other signs earlier before you actually, stopped working at Channel 9, stopped waking up at that ungodly hour of 3 o'clock in the morning, where you just had this sense that something might not have been right? Or was it really just, as you explained it to me, when you got on that treadmill?
Yeah, I didn't have any previous knowledge. It was after the fact, though, when, I was training for the mountain goat race the previous year. They had moved the mountain goat from May to October, a 10-mile race.
Right.
I was going to train with it with my daughter. And so I was taking a training run with her in probably late September or early October. I don't know exactly when, but it was in the fall. Just a 7-mile training run, which I was be able to now. I had to stop on that 7-mile train, and I walked. And I said, Anna, I can't go any farther. Let's walk back downtown. But I thought I was just tired. But I got home and sat in an easy chair in our living room after that training run that didn't exactly finish well, and my wife and my daughter both said, "Boy, you look terrible, Dad." And I thought, "Oh, I'm just tired. I'm not." And they didn't make anything more of it, and neither did I.
I mean, it seems obvious, but, what is the lesson here that people listening and watching should take to heart?
I would both pay attention to those signs that I didn't pay attention to. If your wife and your daughter both tell you don't look too good, Dad, okay, but and then and you're getting tired, I suppose I could have asked earlier for like some type of checkup. But my blood pressure, I had no blood pressure. Everything was great. I had no warning signs. My cholesterol was always good. Everything that would be normally a tip-off to like a heart problem. So I never even imagined. And I don't know. I guess if you're not feeling well, give your doctor a ring and make sure you get in and say, because that was the only tip-off that I just didn't feel right. You know, I do think it's a good idea, since you asked what my advice would be now, and ask the cardiologist when you talk to him, but about getting a scan maybe to see what the calcium lining is like. They can do calcium scans now to see. That's very non-invasive, from what I understand.
I had one.
How'd you do? How'd you make out?
I had a score of 0.
Wow. Good for you. My brother had one that was 50, which isn't good.
Wow.
So,
right. Okay.
And I never had one. But I never had a heart attack either, thanks to Krause. So take me to Krause. Can you see that coffee mug? That's what it says.
Dan Cummings, you are one of my favorite people, and I cherish our friendship. And I am so grateful that you took action, that you came to the right place, and that you are now enjoying your retirement.
Thanks.
You've earned it.
You're one of my favorite people too, Carrie. And seriously, they saved my life here. I'm convinced of it. I don't know what would have happened, but it probably wouldn't have been good.
Yeah.
Thanks.
Thank you. And when we come back in just about 20 seconds, Dan's doctor here at Krause will be here to talk about how he saved Dan's life.
For more information on what you're hearing on this podcast, go to krause.org/Carrie. The information in this podcast is not intended as medical advice. It's always best to check with your doctor.
And this is Dan's doctor here at Krause, cardiologist Dr. John Ulehan. Thanks so much for being here. And most importantly, thank you for saving Dan's life.
Well, thank you for having me. It's really a team effort with these things. We're the ones who get to take the credit at the end of the day, the interventionalists, but it's really a big team in there helping me. There's 3 nurses with me doing the procedure, and we can't forget about my non-invasive colleague who read the stress test, my nurse practitioner who ran the stress test, the sonographer who took the imaging. It's a big team that goes into taking care of one patient.
Dan explained to us what it was like being on the table in the catheterization room and hearing you say repeatedly, stent in, stent out. Even with sedation, he understood that there was a problem and he was really starting to get worked up. And then you suggested perhaps trying something else. What was it that you did that saved Dan?
Well, so this was in 2022, and back then there was a new balloon that emits shock waves to break apart calcium that's stuck in the vessel wall. So calcium is one of the things that we're finding leads to underexpanded stents and then stents that tend to block up over time. So without treating the calcium, that stent is likely going to fail. Okay, either several hours later, several days, months, years, but if you don't properly expand a stent, that's going to fail. So in order to treat the calcium, before this balloon came out, and we still do this from time to time, but we'd have to drill through the calcium. And that comes with risk.
Yeah.
So a balloon that emits shock waves is much more safer. Okay, and that's what we treated Dan with. I think we had just gotten the device, either earlier that year or a few months before.
How confident were you at that moment with this new device and this very vital guy on that table that it was going to work?
Well, sometimes it's trial and error. Sometimes you try one thing and realize it's not working. With him, immediately we knew it was going to work just because of the way things were going.
So you then explained to him and his wife that he had a 95% blockage. Dr. Ulahannan, how do you walk around with a 95% blockage in your heart? How do you function?
There's two types of patients I see, all right, or we see. There's the type who they're feeling okay, perfectly okay, and then all of a sudden they get classic chest pain, chest tightness, shortness of breath, sweating. That's the type that you read about in magazines or you read about in the news. It's very obvious that person is having an issue. Oftentimes, like with Dan's case, oftentimes it's a slow progression of symptoms, okay? And you might not be even aware that you're slowing down. You might take a little bit longer to go up the stairs. You might feel more tired. I have a group of patients who every year they're going to the game, on the hill, and they'll be like, hey, I was able to walk up quicker last year than I was this year.
Yeah.
So sometimes it's very subtle when it's a slow growing process, which I suspect that's what was happening with Dan. It's just a very slow, insidious almost type of process.
Right. Is it more common to have symptoms or more common what Dan had?
I think nowadays it's more common to have something like Dan, where it's not classic symptoms, chest tightness, going to the left arm, going up to the jaw, although we still see that all the time. But all the time I see people who have gotten on the cath lab table for some reason. Maybe they had a stress test for preoperative reasons. Maybe they felt something odd 6 months ago. Someone ordered a test and so on and so forth. And they swear to me that they're not feeling anything. And we do the angiogram for appropriate reasons, find blockages, right? Find obstructive disease. And then after the procedure's over and I tell them, well, this is what I found, or after we've treated it, like, are you sure you weren't feeling anything? And that's when they admit, like, well, hey, I've been feeling fatigued or short of breath for 6 months, 1 year, 2 years, and
Yeah. Dr. Ulahannan, this is what I'm wondering. And you are a cardiologist, not a psychiatrist.
Right.
But I have to ask you, it seems like Dan and probably a lot of people who have a lot of fear around this are always looking for signs that they're okay. Oh, my pulse is fine. I can still function. Maybe I'm just tired, and that's normal. I should be tired. But maybe people should think about, well, wait a minute. What are the signs that something is wrong?
Oftentimes I find it's fatigue and shortness of breath. Those are the early signs. Chest pain comes later, okay? The early symptoms are fatigue and shortness of breath. Some people actually are fine. A lot of people, they have the family history, they're worried about it, they might feel a twinge in their chest. That's okay. You can talk with your doctors about that. Just because you have a symptom for a couple seconds and it goes away and you're still able to exercise, good to talk about, good to make sure that nothing needs to be done.
Yeah.
And it's also reassuring to hear somebody say, okay, this is okay.
Yes.
But at the same time, if it's something consistent, fatigue that you've been feeling that's new for the last 6 months, shortness of breath that's new for the last 6 months, the key is something that's brand new. Okay, you weren't feeling this a year ago. Okay, that probably should be looked into.
How much longer could Dan have walked around with this 95% blockage?
That's hard to say. Actually, Dan asked me that.
Yeah.
So I said, you're going to fit into one of two categories. There's some people who come in with a heart attack, okay, that the 95% blockage that shuts down immediately, you feel it. That's when you get your chest pain. You come in and we get to do the procedure in the middle of the night.
Right.
Which is not ideal. Right. And then there's some people who that 95% progresses to 99, 100%, and then the muscle downstream doesn't get enough blood flow and just stops pumping, all right? Then the presentation is actually heart failure, where your heart's not pumping strong enough. Not a big heart attack, but where the heart's not pumping strong enough, then you're kind of behind the 8 ball. It's very hard to treat. You can treat it. There's still therapies available. It's just a little bit more complicated, all right, and not always effective. So the earlier you get to see a doc and you get to see, at least talk to somebody about this, the better.
Can you talk a little bit about lifestyle? Because Dan recognized that he was anchoring the morning news. He was getting up at 3 in the morning.
Yeah.
He wasn't sleeping. He said
Right.
4.5 hours a night.
Right.
That isn't great for your heart. It isn't great for your health, right?
Right. So, lifestyle really matters for heart disease. That's what they're finding. New cholesterol guidelines actually just got published, I think like 1 or 2 weeks ago. So it's brand new, and they're really harping on the importance of a good lifestyle, and that's healthy eating, like Mediterranean style diet, getting a good night's rest, sleep, stress management.
How important is the family history piece?
That's actually more important. That's just a reword. No, that's actually gaining more importance. It used to be you'd acknowledge the family history. You don't really know what to do with it. You would say, well, hey, there's a family history here. You can't really change anything about it.
Right.
It's your genetics.
Yes.
Okay, but we're starting to realize it is even more important than we thought. We always gave it importance, but now there's certain particles that we can actually check in the bloodstream that can be a marker of someone who genetically is predisposed to developing coronary disease. And this is the medical term for what Dan had.
What's interesting to me is that if you can determine
Right.
the genetic risk,
Right.
you're saying that the lifestyle choices you make can impact what might happen to you.
Right. A lot of my patients who come in with big heart attacks in their 30s and 40s, 95% of them have a genetic predisposition, meaning, mom or dad had heart disease younger than 60, and they're smokers. Okay.
Yeah.
So 95% of them are like that. I think the other 5% are probably lying about the smoking. We can cut that if you want.
Right. No. We won't cut that because that is really important. I
Right.
think, the most important person to be honest with in the beginning of all of this is yourself.
Yeah. Yeah.
Right. Well, Dr. John Ulahannan, again, thank you so much for being here and for taking such good care of Dan, not just Dan, but all of your patients here
Oh, my pleasure.
in
Yeah.
Central New York
Yeah.
at Krause. And thank you for being here, for investing this time in your health. Informed patients make stronger decisions, and that starts with information you can trust from people who actually provide health care in our community. That's why we do this. I'm Carrie Lazarus. We'll see you next time on Take Me to Krause.